For this cultural competence assessment, we're looking at Jacy Redbird, who is a 41-year-old who has been admitted following an acute pancreatitis episode. It's suspected that the pancreatitis is as a result of one of her medications she was taking, so she's since stopped. Upon looking at her chart, I assessed her height and weight, found that she had a BMI of 39.3. Some relevant diagnoses included acute pancreatitis. She has type 2 diabetes, non-alcoholic steatohepatitis, hyperlipidemia, obesity, dehydration, Sjogren's syndrome, fibromyalgia, GERD, and sleep apnea. And some medications she's on include metformin, Cymbalta, Mirapex, Zofran, fish oil, acetaminophen, Loratab, melatonin, and then she was on that Victoza and Amarin, but they were stopped, as I mentioned, suspecting that pancreatitis. Some labs included high glucose, some high lipase, borderline high triglycerides, and cholesterol, as well as a low potassium score. And she has been experiencing some physical symptoms of nausea, vomiting, diarrhea, a lot of gastric pain that's radiating to the back, as well as decreased appetite, dehydration, and abdominal tenderness. The patient is a nurse. She is busy with that. She says she walks 2 to 3 times a week, doesn't smoke, maybe has 1 to 2 alcoholic beverages per week, but she also reports having difficulty following diabetic lifestyle recommendations. So in addition to the information on the patient's chart, I would collect information relating to her usual eating patterns, her consumption of carbohydrates. Is she eating a lot of carbohydrates in one sitting, or are they more spread out throughout the day? Just in terms of the effect of carbohydrate on blood sugar levels. I would also look at her fat intake, her recent weight history, hydration habits, and nutrition knowledge. I would assess her readiness to make nutritional changes and ask about the ingredients and frequency of consumption of the traditional Cherokee tea and salves, just to make sure that there aren't any interactions with medications or possible effects on her health conditions. So my PES statement for this patient is as follows. Nutrition-related knowledge deficit related to limited understanding of dietary recommendations for diabetes, pancreatitis, and non-alcoholic steatohepatitis, as evidenced by the patient struggles to follow a diabetic-friendly diet, hyperglycemia, obesity, and hyperlipidemia. In terms of a nutrition intervention, I would recommend a heart-healthy, controlled, or carbohydrate-controlled eating pattern that is also appropriate for NASH and recovering pancreatitis. So initially, nutritionally, this should encourage moderate and that consistent carbohydrate intake, lean protein, whole grains, fruits, vegetables, while really gradually introducing fat and ensuring proper hydration. She was dehydrated. Long-term goals should also support her improving blood glucose levels and lipids, looking to consume balanced meals, and creating nutrition-based SMART goals, depending on the patient's needs and struggles. Practicing cultural humility and competence with this patient may include asking about traditional Cherokee foods and eating preferences, and working to incorporate these in her diet when desired, acknowledging her work as a nurse, and identifying meals and snacks that will work with her schedule, and overall just being respectful of the patient's American Indian heritage and asking questions about that will help support her when it's appropriate. I would recommend an infographic on carbohydrate consumption with type 2 diabetes. Again, I'm having some technological problems, so I'll just upload that with my paper and not show it here on the screen. And in terms of monitoring, I would seek to track her adherence to a carbohydrate, low-fat eating pattern, that blood glucose and A1C, her hydration status, lipid profile, and any other gastric complaints or symptoms, and confidence and adherence to her nutrition practices that support diabetes management.